But now let's cross back to Birmingham and the Naidex exhibition. Our reporter Robin Ross has been finding out about the impact of the new personal independence payments.
Having a disability doesn't mean you can't achieve your dreams. One such person who believes in this is Adepitan, Paralympian and TV presenter. So the Paralympics, it was an amazing time for the country and for the people with disabilities.
Yeah, last year it was mind-blowing, and as people say, it was a game changer. And the great thing about it is, unlike my time, when I was growing up, there are now role models for disabled kids and able-bodied kids who are Paralympians. You know, when I was growing up, I was looking up to people like Daley Thompson and Seb Coe. Now our kids are looking up to David Weir, Ellie Simmons and Johnny Peacock. And I think that's brilliant. It means that if you have a disability, you don't have to feel that your disability or your impairment is going to hold you back, because you can be a hero as well.
So you've done fantastically well, you have an amazing amount of drive, but some people don't have that same drive. Is there one thing that you think could be done to improve people's lives?
For me, I'm a really, really big fan of schools and teachers, and I think that's where the inspiration comes from. You know, and I feel the government needs to motivate and support teachers and schools a lot more, because that's the building blocks for the future.
One of the hot topics at the moment is the personal independence allowance. What are your feelings about the allowance?
Yeah, it's really controversial, isn't it, PIP or PIP, and it's interesting what the government have tried to do. I think they could have just adapted disability living allowance rather than gone through this whole complicated scheme. But we won't know really until a few years' time to see whether it's successful or not.
If you have a disability, it's important to remain independent and have the lifestyle that you want. One person helping to do that is Dr. Alison from the Department of Health. Thank you for joining us. Do you want to tell me about the personal health budgets? You're really driving this forward, aren't you?
Yes. I hope so. Personal health budgets are a way of giving people more choice and control about how their health needs are met. They centre around a plan and a planning process which enables individuals to work with healthcare professionals and others to set what health outcomes they want to meet and health goals they want to meet, and then enable people to plan to do that in ways that works for them. So instead of the state telling them how to go about things, how to do, it enables them to do things and to think things differently.
So there's been lots of criticism about this budget and people taking advantage of it, maybe buying drum kits or sat-nav. Does it really work? Can they take advantage of this?
I think what you have to do is you have to think about instead of thinking about the item in isolation, you have to think about the overall plan and what it's there to achieve. So, for example, a drum kit, and could be used for somebody who has communication problems, behavioural problems, and is unable to express themselves and gets really wound up because they're trying to communicate and they can't communicate and people don't understand them. So being able to express themselves through a drum kit could be a really positive way of meeting health needs and actually stopping people from getting depressed and self-harm and having behavioural problems.
And what do people tell you they want out of life? What is the big thing that they want?
People want to be independent, they want to live independently. Some want to go back to work. This is a very personal thing. For some people it's going back to work, for others it's being an active part and playing an active part in the community, whether that's just being able to go out to meet friends, to make new friends, or supporting and helping other people.